Say, listen, if so far you have considered all of us on a Halloween to be a pain, we can take care of that too. We do it all on the Morning Scramble. I think probably the concept of being pain-free or having pain relief is something that virtually everybody at one time or another must desire. And our guests might have the answer. Dr. Okky Oei and Sherry Gann are here. And Doctor, as the medical director of Renewal Technologies, I'm fascinated by this LaserTouchOne because it seems almost as if it's a promise that nobody can fulfill. The magic wand that takes away your pain. How did it begin?
It began really with a personal injury back in medical school that made me realize that I could not tolerate medication. So when I graduated from medical school and my training, I started looking at other things other than a prescription pad. And it led me to getting certified in acupuncture. And then eventually when I moved here in '84, initially to do family medicine, I ended up with a pain practice within 6 months and felt that I needed more knowledge, more tools to help these patients other than injections and prescription drugs. And so I got involved in something called microcurrent electrical stimulation. And the history of electrical medicine really goes back to the Greek physicians, Egyptian physicians. They used electric eels. It was a crude way of treating foot pain. Today, of course, we are much more sophisticated and we have been able to harness the energy of electricity in a precise amount which mimics the body's electrical circuit.
And some acupuncturists use electric connections also in their practice.
Absolutely.
Is this the same concept?
Well, the concept is really a combination. Our device is really now a combination of cold laser and electrical stimulation. And the idea is that, one, it's at a very low output level, so it's safe. It mimics, the electrical part mimics the body's electrical system. And it is designed to help stimulate the source of pain and help the tissue work again.
And it's approved by the official governing bodies who do that kind of thing.
Yes, not only prescription, but also over the counter.
And almost as important, it's approved by Sherry Gann, who was the recipient of this particular treatment. And as you get ready, let me ask you, Sherry, about pain that you've experienced as a professional cyclist. See, if I hear professional cycling, automatically I think pain.
Yes, it is a painful sport, and you know, because I'm racing for days on end, and my legs would get very sore, my muscles very fatigued, and I would use the laser after every race or before races to help with the muscle soreness. My muscles almost felt like I didn't race as hard as I did after I used the laser.
So you would use this when you're talking about using the laser, you're talking about using this instrument. Could you demonstrate, please?
Absolutely.
Because if Sherry happens to be in pain right now, we want her to leave
When we
much
designed
happier.
this, we made it deliberately very simple.
Oh.
So this is the device, and there's only a one on and off switch that stays on for 2 minutes. And I don't know if you can see the laser light here, but it also has...
Do that one more time to make sure.
So here's the laser light,
And we must look into that.
And then it also has, yeah, it's suggested not to look into it. You can't really burn anything with this strength laser, it's very low. And then 2 electrodes that put out the electrical current, adjusted or controlled by a little knob on the side here. So it's simple, easy to use, and we did that deliberately so there's no confusion.
So if you're talking about, please go ahead and demonstrate with Sherry.
So if I may just stand behind and, Sherry, do you have any neck soreness?
I always have a little knot right here.
Now we use an electrolyte conductive gel.
Right.
Do
we have to have a specific kind of gel to use this at home?
This is the type of gel, and it's to conduct the electricity because we're using such minute amounts of electricity. Go ahead, Sherry. Sorry, I didn't mean to interrupt you.
No, I was just going to say I have a knot a lot of times from working on the computer using the mouse. I tend to get a knot right here.
So I put a little dab of the gel or the conductive gel.
Oh, you put it on the instrument itself?
I put it on the instrument and then just spread it a little bit. And in many cases, I test it on an area that I don't treat, either the snuff box here or the cheek. And what you do is you turn on the laser, the electricity is totally off, I spread the gel, and then I turn it up till she feels it.
I
Let
can
me
feel
know.
a little bit.
And can you describe what you feel?
It's just a tingling.
Right. And
Just a
when I
tingling
work here,
sensation.
I oftentimes have them do range of motion to see if there's any restriction of the tissues, and then just go and work the area. And you spread it, and I use a little bit of pressure because we designed it so you can do almost like a mini massage. And I feel not right there. And oftentimes I have her do a little pressure against my hand to activate the muscles. And it's really simple, and as you can see, in the area where the knot is, oftentimes a little redness appears. And I don't know if the camera can pick that up, but there's a little redness here.
A little.
Now, work that and see if that feels.
Now, is it possible to turn the electricity so high that there would be discomfort?
Oh, yes. Oh, yes. As a matter of fact, at the high end, I use it as a testing device also. When people come in and say, I have numbness, I can't feel anything, I can actually check if the nerve is still alive.
So you
And if
should
it's
be
like-
at least careful at home
Oh, at home, yes.
about using
absolutely.
this. Please have a seat and let us know about the event that's coming up November the 4th and 5th.
Yes?
Should I tell everybody?
Yes, please.
Okay, because every once in a while when you mention an event to a guest and the guest looks at you like, what are you talking about? You know it may be up to you to talk about the event. It's the Arizona Geriatrics Symposium, and it really isn't apparently for the general public, but it is for professionals, and this will be demonstrated at that area at a retirement center. So it's 11th, 4th, and 5th. And if you want to find out any more about that or about LaserTouchOne, how do they get in touch with you?
Well, there's a phone number that is, and I apologize, I don't memorize phone numbers, but it's.
If you don't,
can we-
if we don't have the phone number, we will. There it is.
There we
Look
are.
at this. Look at this.
Wonderful.
As
Great staff.
requested, instantly coming
480.
through on the Morning Scramble.
Right, yes.
Find out about that, and do tell me the price for the individual consumer.
It's $489.
Okay, and this is virtually a lifetime unit.
It's a lifetime unit, and it's a rechargeable unit. I didn't bring the charge in, but you plug it in the back. It's a universal charger, so you can use it anywhere in the world,
And it is approved.
and it is approved.
And so is our sports director, Eric Cohen, who's coming up next to talk about the Cardinals.